Hi, I am Dr. Gaurav Jain. I am a consultant in internal medicine and I handle endocrinology as well. Today we are talking about understanding de-addiction. So what everybody seems to think is de-addiction is either very easy or very difficult, and it is neither. First we need to understand what a person is addicted to. You can say a person is addicted to smoking, or a person is addicted to alcohol, or maybe a person is addicted to drugs. But what about that fact makes a patient addicted? Maybe it's just that because he feels it's cool to hold that smoke between his two fingers, or maybe it helps him breathe easy, helps him control his emotions, helps him control his anger, or maybe calms him down. Maybe it helps with his gut, maybe it helps him pass stools, maybe it has something to do with his inner urges or his sleep cycle. So de-addiction is basically not just giving a person information as to stopping the drug, giving him a few medicines, putting him up in a facility and blocking him access from all these things. It is actually about sitting down with this patient and talking to him. The patient needs to understand that you are his friend, you are a person who wants to help him, and then you need to spend time with this patient to understand what makes him addicted to this drug, what is his requirement out of this drug, and then what we can do is, after the person has the willpower to stop taking the smoke or the alcohol or the drug, is that we can help control the symptoms which make the person addicted or dependent on this drug. So if a person has sleeping problems, we have pills for that. If a person has stress associated problems, we have a pill for that. If a person has issues wherein he cannot pass stools because of that, we have medications for that as well. Group therapies are there, singular therapies are there, behavioral therapies are there. So there are a lot of options that are available. New drugs are available, less side effects are there. We have methods wherein we have a psychologist, physicians and our neurologist who work together with this patient to help them. Here at Dharamshila, we face a lot of problems because of these addictions. We get cancer patients of the lung, cancers of the mouth, oral cavity, of the nasopharynx, of the liver, of the intestine. And all of those could have been prevented had this patient not been addicted to certain tobacco or alcohol and other drug products. And I urge all of you to actually look into getting you and your family members de-addicted so that you can prevent yourself from developing these complications rather than being dependent on these drugs, waiting for the complications to develop and then getting stuck with a very massive bill with chemotherapies and surgeries and operations and a shortening of life. So it is very important to identify an addiction early on and then consult your doctor so that you can be put on the right track so this can be prevented for future. Thank you.